Earlier in the newscast, we brought you a story about a news anchor in Tulsa, Oklahoma, who suffered stroke-like symptoms during a newscast. Doctors believe she had the beginnings of a stroke, but not a full stroke. Dr. Gregg Silverman joins us live once again to continue this discussion over the symptoms. And Dr. Silverman, what are you seeing in your practice and here locally? Is it as common as we think? Are there multiple cases a day, or how does that play out?
Very, very common, as a matter of fact. There has been a couple of studies that were done around Nueces County for the numbers of people who have them. And it turns out that in the Hispanic community, the numbers are actually going down. But in the non-white, non-Hispanic whites, the numbers are actually going up over about the last 10 years. So the numbers are becoming a little bit more even across the board here. We are seeing it because our population is aging, because of the increase in the amount of diabetics, the untreated hypertensive. That's our wheelhouse. That's the risk factors for people who have strokes.
Well, I would like you to know we did receive a viewer question I'd like to read to you really quickly. They say I'm having those symptoms as well, but they just look at me and they're referring to the doctors and say that their blood test is always fine, and so the doctors tell them they're fine, but that they're dealing with dizziness. Any advice?
Well, I mean, you kind of got to trust the doctors there. It's very difficult to determine without actually seeing somebody and getting a CAT scan of their head. Basically, the treatment is come into the emergency room as fast as you can. If you have symptoms suggestive of not being able to move your arm, or not being able to see well, or a facial droop, which is one of those be fast. Remember what we talked about earlier, the be fast. If you have balance issues, if you have other types of issues, it's very important that you get to the emergency room. It turns out that only about a third of the people who can get treated aggressively because everybody just kind of waits for a little bit before they get going or before they go see a physician. So really one of the things I want to get out there is if you feel like you're having a stroke, go to the emergency room. If you're having trouble walking or talking or have droop somewhere, go to the emergency room and let them take a look at you.
Okay, Dr. Silverman, again, this is your wheelhouse, and so we appreciate you waking up a little bit earlier, and we usually see you on Mondays. It's great to see you on this Wednesday. Make it a great day, sir. Thank you so very much. And again, if you have a question for Dr. Silverman, we can get it to him throughout the day. Text us 361-855-6397. And thank you to the viewer that submitted that question for us as well.